Hello everyone, I'm Jana. I work as a patient consultation expert at both wannabe taller Medzonia and height reduction Medzonia. Today I will conduct an online interview with two leg shortening patients from two different European countries. I will shoot some topics about limb shortening for discussion. They will share their views based on their experiences and perspectives. By the way, I'm not sure, but this might be a first. I don't suppose that there has been an interview with patients who have done cosmetic leg shortening surgery before. I didn't see it on YouTube at least. Anyway, I will refer to them by nicknames to avoid revealing their real names for your information. Alright, so Anna, how is it going?
Very good. Recovering well. I'm still 2 months post-surgery, post-recovery, and everything's fine so far.
Thank you very much. Belle, how is it going for you?
It's going really fine. 1 month after surgery and paid no complication. It's very great.
Perfect. Alright, so before we start, let's talk about briefly what your height was before the surgery and what it is now. Anna, I would like to start with you. What was your height before the surgery?
When we've measured on the scale, I think it was between 171 and 172, so something around that. And then now it's 166 or 167, 0.2.
Alright, so you had 4.8 centimeters reduction on the femurs.
Yes.
Alright. Belle, what was your height before the surgery?
When we measured with doctor, it was 183.
So you had how much reduction?
4.3.
4.3 centimeters. So you're around 179.
Yes, 178.5. Sometimes they remeasured it was 177.5. We sort of did surprise me that it's like depends on the spine during the day. So, yeah.
Exactly, like the spine compression and decompression. Alright, so if you're ready, shall we discuss the topics about limb shortening?
Yes, ready.
Alright, we will proceed in this format. I will share the topic titles on the slides and give you 1 minute or maybe 2 minutes depending on the topic to express your opinions regarding the title. Alright. Pain after the limb shortening surgery. This is the most frequent question I've been receiving so far about limb reduction surgery. Anna, let's start with you.
To be honest, it sounds surprising, but because of all the drugs, the painkillers, and the anesthesia, I didn't feel pain, more so the discomfort. Like it's still good. I really wanted to move, and I really it's this really annoying feeling, but not like painful, like you rub cuts, which is what happened. You were not of cuts on your legs, your bone and muscles, everything is like something hurts. It sounds painful, something that sounds so scary, but that's not what I felt. I felt like my body was like concrete, like I was like a statue for the lower half of my body, and that was the hard part for me. It was really hard to adjust. Like it felt like I was like not light and carrying my own body. So that was what was the painful part for me. It wasn't really like speaking pain, especially with all the painkillers. I think the medication really helped a lot with the post recovery.
Exactly 1 minute. Wow. Alright, Belle, let's continue with you. What was the pain after the limb reduction surgery for you?
For me, I already was on one operation of lower jaw before, and I was also surprised that the operations are not as painful as I imagined. And I imagined that this will be maybe a little more painful, but it was even less or same than just a little bit of cosmetic like operation. So it was surprising that it wasn't painful at all, and as I must say, like, the worst part about it was the fearing of not being able to move after the operation and then need enough, like, to make it to some extent, but the line for physiotherapies, it's really unpleasant to move. Well, it's mentally harder than the physical thing.
40 seconds. Like almost 1 minute, but that was good. Like very just informative. So like in your case, rather than pain, psychological pain was more dominant, right?
Yeah, because I'm a bit discomfort.
Yes, but I have idea if to say something under pain, like maybe after the outbreak, I woke up from the outbreak and I was still like gulp and a little bit shaking from the muscles were contracting and the places where the cut was, so it was a little bit unpleasant. But when I gave like sprinklers and sedatives, it went away, so it was only.
Same for me.
Okay. Let's go to the next topic. Is scarring bad? Anna, let's start with you.
They're quite small, smaller than what I expected, especially if you think about the whole bone situation. But the now I feel it, the feel like thicker than some people, like when I fill up Belle's scarves, because they were bare at the same time. But can I show my hubby switch the camera? Here. So I have these silicone scar sheath. These were recommended by the laser unit. They do laser removal and they help a lot keeping them moisture and with recovery. So this is what they look like 2 months. And this is the big one. Oof.
Where the one was reduced.
Yeah, so let's quite flat and red. But like easy to cover if you're worried about that. That yeah, this is what they look like.
Thank you very much for showing the scarring. By the way, like, I mean, the doctor does his best to minimize it, but still, you know, there is inevitable invasiveness to reach out to the bone and just extract it. So he needs to open some space. That means cutting the skin. But so far it looks good. But you think that Belle's scarring looks good?
So it was very beyond genetics of the person. I don't know much about the medical stuff behind it.
Skin texture,
in that also maybe the product you use, how much you stretch your skin, maybe something like that.
Or you can maybe just get laser treatment in the future after nail removal surgery, perhaps.
Yes.
All right, Belle, let's ask you, is scarring bad?
So for me, I wasn't searching much about the scarring. I just saw some pictures and said, it's okay, like, it's after every operation. It doesn't look something dramatic, but it surprised me there is one of the little scars, but I think it's still okay. And like there are ways to make it less visible, and I think it's okay. It doesn't look unusual. I think the one would ask, like, where is this scarring from? And I can show mine too. Like what I noticed, after shower, after the nursery of the stitches, like it was better for the scarring when it was dry. But when water got onto it, it get more darker. But I don't recommend like going into water immediately, because I noticed that during I can show my example.
Okay.
Oh, this is the big one. It's same both legs.
Both of yours look almost the same, in my opinion, but the viewers also can state their opinions.
And here sometimes after the operation it was more like more curved, the scar, and if getting better. I noticed that after the cream it got like more straight, and with time it's getting really much better.
Well, just it's pretty new for both of you. I mean, just like Anna, for you it's been 2 months. Belle, for you like almost 1 month. I believe that 4 or 5 months later it will look way better, smoother, and less darker, in my opinion. The next title, well, complications. We can specify it for like The biggest complication could be muscle imbalance. One muscle gets shorter, the other one could be longer because of this, like the change in the height. Let's specify it in this way. Have you had any minor or major complications in your recovery phase? Belle, let's start with you this time.
Okay, so after operation, I had only complete urine checks because it rises for urine because I can't move or go to toilet, and I had like a rock inside, so my blood like will thick through it. I think that was all. Didn't have any special complications, and yeah.
Alright, so your genital area did bloat a little bit because of this maybe sensitivity and like this, the bladder, the tube, right?
Yeah, they like trying to wash the tube out, like to get the rock out, but it hurt it every time they tried. But it was all from my
Alright then, like for the viewers' information, after the surgery, that's acceptable for limb lengthening too. Patients are put catheter to let their urine like go easily, but it's accepted for a couple of days. In some cases, it might take 4 or 5 days, but usually 2 or 3 days after.
Yeah. Idea what's important to say maybe also like usually for people who take one of purpose like the microflora of intestine is damaged. So if I didn't bring Michael from home to like because I get like with a bit stuck like in intestine and it wasn't going out of everything else. Some people didn't like what she'd live or did with the more unpleasant thing just to take it though. So I would recommend to take on girls for like first day in here.
Like to like for digestion and just let it out, you mean like the pills?
Yeah, right, and laxing. Yes, I heard like also lactobacillus or the microflora, so I didn't have many of complications, but some people may be sensitive that after those lot of medications, because we had like 6, I think, that it's usually available.
So you recommend patients can bring some pills to make the digestion easier and, just like you don't have problem to go to the toilet in a simple way. Anna, in your point of view?
Okay, my complication wasn't like as intense, only it was just the side effect of the anesthesia, not the surgery. I vomited everything I ate, even if it's just a small cookie or small bite of breakfast. I would vomit everything, so I was so hungry. But anything I would consume would just go out, and that made me feel really bad. So I had to stop taking these medications via antibiotics early, and some of the medications are kind of outed by the doctor to fit what would make me not vomit anything. So I guess for that, maybe bring some snap bars or something that would help you make full. I don't know if this is for everyone. It depends on the person's reaction to anesthesia, I guess. But yeah, that was the only bad thing.
Well, in my opinion, it might vary person to person. Belle, did you vomit a lot after the surgery?
No, I didn't vomit at all. I had the feeling I want to vomit the day of the operation, but after it lasted, and sometimes I didn't like the Turkish from, so that was the reason I wanted to vomit, that it wasn't connected to the track of first.
Well, thank you for your honesty. Like, most of foreigners actually like Turkish food, but, like Mexican people, Chinese people, and of course, like some people from European countries, it can be a little bit oily, sometimes sweety, sometimes salty. But overall, at least you can find some options, right?
Yes.
Okay. The next topic. Well, this is also a very extensive topic. The taboos surrounding limb shortening. Well, to specify, when we hear about limb shortening, what could be the taboos on your mind?
People say it's unethical. Oh, first, people say it's unethical. Like, people say it's just something bad. It's crazy. It's not normal. You can never go back to playing sports to be normal. Why would you live disabled for the rest of your life? That's not true.
Thank you very much. Belle, what comes to your mind?
I agree when I literal documents by people I reviewed, but I think everyone has own story for it, and that goes for this when it's like really what we say disturbing the day-to-day life, so it's worth it for the people, and I would say like they was judgmental towards it, but there will be always some critic from people, and they will have opinions. So that's I would say maybe the hardest part of the operation. The unempathy of other people.
Did they add something?
Of course.
There are some people that are not part of the company, for example, like, delivery or like some ambulance people that they question you and they make you feel like you're doing the craziest thing ever. So yeah, she's right, but that is kind of really hard. One of the hardest thing about it is like people think you're doing such a crazy thing.
Well, it's new, it's not common. Fingers crossed, hopefully it's gonna be popular as limb lengthening in the future and people would be less judgmental.
That helps them.
The next topic is it right decision to go for this surgery? Belle, we can start with you.
Okay, so I think like it's very subjective. No objectives like answer for it. But I would say it's like person only has like feeling of being unpleasant with the height. It's like too much for the body to take this. But if like it's disturbing someone's life on the level that they don't feel good around people walking on the street, like not sitting straight or standing straight, I won't say it's sure like the best thing they can do to make themselves grow better. And I hear not compared with that you done before, and for me it was definitely worth it. But that's why I also went for the operation, that it was very disturbing my daily life, and I knew that even with the risk it's very fit for me. But I had like my serious reasons for that, but it wasn't only for like some little series of not being like comfortable with the height. It lost more deeper than that.
Thank you very much for sharing your opinion. Anna, what do you think about it?
Me personally, yeah. So it's something that really has made me happier, especially is right instantly after the first time standing up. I was already instantly very happy, but I don't know if it's for everyone. I think, especially if you're younger and this is something that would make you happy, that you get to spend the next few years, the rest of your life actually, with this new thing. So it would make you happier in the long run. If it's something that you really want, then yes. Same with anything, your nose,
You're right. I mean, just like some people are not satisfied with the shape of their noses. They do the surgery, but most of them support their friends to do this. But when it comes to limb shortening, yes, it's more invasive. However, if you have a good reason behind it, it could be medically or cosmetically. And if it makes you like more confident, less obsessed with the thought that's stuck on your mind, it could be worth it.
Did I ask what? That I think like different between like I do nose jobs and this is like you feel it every day. Like sometimes when you have problems with your face, you don't realize it through the day, but every time you walk and you feel unpleasant, it's really worth the money, the operation. It's changed.
I agree.
It's really hard.
Well, in my opinion, you're right, but some people will definitely have some judgments or bias, like criticism. So
there is something that Belle said that stuck to me, Ang. She said they collaborate their legs all the time, but we get something new out of it.
That's, yeah.
Right?
The suitability of the surgery for everyone. We can specify it, well, if everyone is suitable for the surgery, or, well, some people can be eligible for the surgery. What do you think about it? Belle, let's start with you.
So first, I think the physical side, it's for the doctor to just like, you need to have some special bikes like this to go for it. Like you must have like certain length of the femur to be taken, like certain amount of centimeters. But I think I'll talk about the mental part of it, because I didn't feel well and I was going for the surgery to like, I was on trip, I will handle traveling to Turkey, but I wanted for this the bone. Because around growth, you must be mentally prepared, and I decidedly wasn't. But the age loss part of the but it's a very good way, like caretaker picking up at airport and everything lunch. Fine, even at the worst state I was in, but this so I'll frequent it's organ even remote charo, mouth figuring care best or something, because it will be fixing it for me to suit.
Thank you very much for sharing it. Yes, psychological part is pretty important. You can be financially and physically ready, but if you're not mentally ready, even though you have good motivation behind it, the process can be hard for you. But well, just we did our best, but still, you're alone in this country. You don't know the native language. You're in a different culture, so it could be pretty intense for some people, as you described. Anna, what do you think about it?
So, like what you both mentioned, it is for the doctor to decide the other stuff. And others then saying ancho and physical health. Mental health is of course very important. It's something I feel like it's very important that it's suitable for someone that really, really wants it. If you're 50-50 or it's something you might want, but then you don't really want, it might be harder for you to go through the recovery because you're not motivated. You might regret it, like, oh, why did I do this? And then you might hate yourself, or you might not do as much of the recovery process. So I guess it's for someone that really is motivated, that's really decided, and that's something that someone really wants and that affects their life, every day.
Thank you very much. The next title, well, reasons why people might want to undergo this surgery in terms of cosmetics. Anna, we can start with you.
As we mentioned, the though I think it's for people, or this is what Belle mentioned a while ago. It's for people that actually feel it every day in their lives, like buses, airplanes. You feel this every time you go out or every time you're just living your lives. I think this is something that people might want, and then they might want it to a deeper level where they think of the surgery, and then we have to think of all the side effects or all the complications that might come with it. So they have to decide, is it worth the everyday struggle, or is it not that bad where they can just deal with it, So just one reason is really just feelings that you might really need it.
Thank you. Belle?
I understood the question with the different, like about the cosmetics of the past surgery. For example, I was diagnosed before with Marfan syndrome by length of my leg, so it goes out like cosmetics. But usually I think people are more shoulder in legs, and I would say to be like careful how much they will take, because igmil cosmetic real is the proportions a lot, and they may not be prepared for that things. When they have space trained the head, they will get smaller in height, but otherwise it will take from on that. Will report cosmetic it. But make the quick impact if they expect something out a little bit. Yeah, like they need to.
Thank you very much for sharing the opinion. Like when I talk with like potential patients, let's say, they just are kind of like negotiate with me. Well, can you please ask the doc, just like please insist if he can exactly take out 5.7 centimeters. and I like tell them, look, ma'am, or just like, sir, like the maximum could be 5.5, but so far the max was 4.9 centimeters, but the minimum was 4.1 centimeters. So the doctor needs to check the body ratio, the measurements, and accordingly, if you're suitable for the maximum height reduction, why not? But there is no guarantee. And as you said, they have something in their minds, but when the reality and the dream just, overlaps, you should accept the result.
I think we begin or on this topic because there was some question on this. Okay, remember the previous patient told me like she went to 4 point and told me like it's not very feelable for more you are supple and athletes. I recommend actually the opposite because like person might be prepared for the height change, but they are not prepared for the proportions things. And later out then more visible are this purple left. On the legs, just between feeling better because I could feel totally the 4.3 as like with the exchange, but at the same time to be careful for the proportions because fast out it's visible when it falls.
Thank you very much for giving emphasis on proportionality too. All right, the next title. The rarity of the surgery around the world. Is it available everywhere? Is Turkey safe? You can just share your experience about researching this surgery before you did this surgery. Anna, we can start with you.
So from what I researched, I don't think I did that much recent research. I think I did my research in 2022, and the options were, I believe, Korea, China, USA, Turkey, Serbia, and Ukraine. So that's not a lot, considering there's so many other places. But different cases have different fixators, different methods, and then different healing times because of the different methods they use. So I found that this company in Turkey is why I chose Turkey, because it's the methods that they used. And for me, I found Turkey quite safe. Everyone was, helpful with recovery, therapy, and everything. So yeah, quite rare.
Thank you. Bella, your point of view?
I think I looked at those clinics at 2021 and I found Ukraine, Korea, and also Turkey. Didn't even try in Serbia. I think there was always 3 right at the time. And it was, I think it's here new because at the time, even the information weren't that uploaded on this topic. Though I didn't think it would be even possible. It seemed made a scam or something because there wasn't anything about it. So it came into giant pain for me. And yes, there are different methods. I looked at the Ukraine clinic also, for example, and I don't want to anyone never something, but it didn't seem like something I would want to go through because they were it's still 6 stages or something.
Elizarov.
Yes, and I was searching more about the operation process that they don't want to do medical purposes, but this method is used around the world for limb purposes, so that's why I went, because it's the same technique that here till end of 20th century, so it's nothing new.
Thank you very much. Well, it's just the technique is pretty similar between limb lengthening and limb shortening, except there is no external device in limb shortening surgery. But on the other hand, yes, the doctor performs the osteotomy, the bone cutting. He inserts the intramedullary nail, fixing from the top to the bottom. And also, he reduces the amount of bone portion. But in limb lengthening, you extract the fracture parts. Okay, the next topic is, the importance of choosing the right doctor. Bella, we can start with you.
So for me, that was very important. I remembered I asked the previous patient so many questions out of Joseph about to enjoy self-believer. I spent outlay the spell for the earth the bubble tits. But the Badek, then who is medicine in our country, and he sent by Turkish healthcare is very good, but depends how much you want to take. When I read a lot on the CV of the doctor and watched it with his details to see like his face expressions, he seems like just and implored him firmly, but he said very wise, so I like immediately asked, and I was also choosing between the makes quick in Turkey, like das Land and I didn't search a lot about the shortening, I couldn't find a lot, but the doctors didn't seem that trustable as this one, so I chose by intuition, but actually I first like came across the article. That's round healing was this one, and this doctor upon who effort. The fact was
Thank you very much. Anna?
And the same for me. I felt more comfortable. Like you can kind of feel where you feel safer because of how he likes to be more precise of these things. Like she has not like those other doctors. When you message their WhatsApp for the clinic, for example, and you ask them, "Oh, can I do this?" And they will say, "Okay, if you want this, okay, fair. If you're a minor, if you're still growing, it's okay. If you have this complication, it's okay. Let's wait off your care." But with this doctor, you tell him, "Look, you're taking this," and he's like, "Okay, I have to check about that. I have to see what medication," and then he's very precise. Like, if he thinks it's not safe, then he tells you, and it's not just like, go, anyone.
Thank you very much for your
I hope
opinions.
that made sense.
And personally, I vouch for the doctor too. I mean, our doctor. Hopefully, we're gonna stick with him in the future. All right. The next title is "What is like post-surgical care and rehabilitation? Any useful tips for potential limb shortening patients?" Anna, we can start with you.
So, to be honest, in my mind, I was already mentally prepared to cover for like 6 months of not being able to walk. But then it was surprisingly much easier after a month and a half, or maybe 2 months. It was easy to do like chores, cleaning and stuff, shower, everything that you normally do except sports and crazy stuff. I was also now 2 months post-surgery able to go to like H&M's, or it's completely fine, completely normal, faster than expected, as long as you really take what the physiotherapist suggests and what they recommend you to do. And you need to be disciplined to actually do it every day, because actually in the first few weeks, you can feel that if you stop for like the weekend for 2 days, that on Monday, you can feel it's really harder to do the same exercises if you stop in the beginning. So yeah, it's really important. That's my tip, to really not stop and to keep continuing, because you will feel the difference in physiotherapy, and keep being motivated to walk and exercise and stuff. That's it,
Thank you very much. Belle?
So get closer, get to care of lower growth. I think this bed was amazing. Sometimes I get pain from the, how to say it, like by vent. That they need to like open new ones because it was swelling, and we had it in common with ML, like the same problem. Everything they put inside after 3 days, it started hurting. So sometimes the nurse is like, if we don't care for until you say them, it's painful. So that's for sure to like tell everyone about your pain and don't get Brussels because but always everyone around you must like notice around if you like. Or take care of yourself and do rehabilitation. I agree. It's like with every physiotherapy is left. I think like this, like to like spouse, but do everything you do. And the beginning is rough. It feels like the normal, mostly like the hardest exercise with him. So it's really hard. Look, it's not like hard that you can't breathe. It's more like hard that you still have their own legs. But the thing like that better fast, that skill, for example, now I'm on crashes and never been like out yet from the home because I traveled with wheelchair. But I can walk like some small distances and can still like 80 But I don't fully agree with Anna, but like lahan ibon brutal exercise, then it's harder for me. It goes the opposite when my
Dataling the blaming.
yeah. But the day I rested more, I could feel more strength the day after to do it. Like the muscles need to the all the time like exercising to get in the light shape, but it's during bad process and it feels unnatural. It feels like you're doing too much to the likes, but that's what they made to do. So like so there's the image of when it hurts a way to stop, but that's when how it makes the thing.
I don't know, on the rest days, it's very important. You can feel the effect of rest days. I just mean for in the beginning, like when you do like knee bend and then you stop during it, that it gets a little bit harder. But that ref, I agree, is very important. But also a kip. Yes.
I think like this process can be really subjective in terms of pre-op and post-op, like psychological part, physical part, the recovery phase. We just saw the example. You had different perspective about the like physical therapy, resting or not resting. So I think patients also should listen to their bodies. Should I stop? Should I continue? Should I just like work out? Should I just like, take it easy, etc.? Thank you very much for sharing the tips. The next title, okay, well, there's no next title because it's over, but it was very flawless, by the way. Just I really appreciate it for like telling your opinions to our viewers. I hope this has been like enlightening and informative for potential patients, let's say. I would like to tell the viewers that if they wish to get in touch with you, they can reach out to me via email, WhatsApp, or whatever they prefer. With the patient's permission, with your permission, I will share your contact details with them, and they can ask their further questions to you if that's all right.
Yes.
All right. So if it's okay for you, I will share your contact details so that they can, like get more insights about the process. It's not easy. It's very intimidating. Not everyone can handle such procedure, and they have to consider whether it is worth doing it or something like something for pleasure that lasts temporarily. So yeah, I appreciate it.
Thank you.
And therefore